Welcome to the Bend Don't Break podcast. We are powered by The Source Weekly, Bend's locally owned newspaper. This podcast is our eddy in the rushing waters of local journalism. We are glad that you're taking some of your time to listen to us chat with the people who shape our local community.
Thank you to our presenting sponsor, RE/MAX Key Properties, a family-owned full-service real estate brokerage specializing in residential, luxury, commercial, new construction, and ranch and land properties. Their new state-of-the-art facility at 42 Greenwood Avenue is a modern, collaborative space and the new home of the Bend Don't Break podcast recording studio.
I am Aaron Switzer, your host and publisher of The Source Weekly and this podcast, Bend Don't Break. Thank you again for joining us. Today, I have Dr. Aimee Snyder, Prevention and Health Promotion Supervisor for School-Based Programs. Dr. Snyder grew up in coastal Southeast Georgia. She is a former middle school teacher and now a doctor of public health, specializing in implementing school-based prevention and health promotion programs. She attended the University of Arizona for her bachelor's, master's, and doctoral degrees in education and public health. While in Arizona, Dr. Snyder coordinated K-12 health promotion programs for the University of Arizona, working with many school districts in southern Arizona. She also created 3 university courses for students to earn credit to implement K-12 outreach programs. Dr. Snyder has lived in Oregon since 2015 as faculty at Oregon State University College of Public Health and Human Sciences before moving into public health practice at a local public health department in 2019. Dr. Snyder is passionate about partnerships between local public health, K-12 school districts, and higher education to integrate effective public health services into schools and provide high-quality, authentic, professional learning experiences to the future public health workforce.
Wow, that was a very thorough
Did you
bio.
like that?
It's a good reminder to keep my LinkedIn up to date.
It's good. Yes, Megan pulls those together for me, and I never know how accurate or how good they're going to be till the person hears it. So good to know.
Well, thank you.
Well, you've been all over the country. Georgia, Arizona, Oregon.
Here, now I have to go
the
find
big L.
somewhere on the Northeast now.
Yeah, you're going to end up in
to
Maine.
Finish my roundabout,
Yeah, somewhere up there. Well, thanks again for taking the time. And I'd love to just start this by talking a little bit about what is your position for the Bend Lapine schools, and then we can branch out from there. But give listeners just a sense of what does it mean to be in that position?
Yes, well, I am employed by Deschutes County Health Services inside public health in prevention and health promotion. So we're kind of
and then
deep
into
in
the
there.
schools.
Yep, and then essentially we are contracted by Bend Lapine schools, and we have a 50-50 cost share. So they pay for 50% of our costs for the Healthy Schools program, and it's me and then 5 of my staff.
Okay.
And so it's just, we created these positions with that agreement that we were going to split the cost.
Right.
But we are effectively the Deschutes County Health Services, which is an important part of our model because we are public health
Right.
Inside schools.
Okay. And are your offices in the schools? Like your 5 staff, are they at a particular schools, at high school, middle school?
Yes, yeah. So our public health specialist is the name of my team, and they all have an office inside of a school building. They work full-time inside middle and high schools, so they don't have an office at our county health department. They are full-time in those schools, and they're split across usually 2 to 3 schools. And then for me, my main office is in the county health department, and that's because I do a lot of that work between the district and the health department. Yeah. And so it helps to have my feet in with our prevention and health promotion team at the county. But I have a lot of meetings at the district office.
Yeah. How does, it's all public funding, but how long has this type of position been in place, or this kind of partnership been in place?
We started this partnership it was July 2021.
Okay.
When we got the board approval from the Deschutes County Board of County Commissioners. They approved the 50% of the share that comes from the county general fund. And then we also already had the approval for the Bend Lapine schools, 50% of their share. So it took getting that budget approval to then create these positions, and that's how this program essentially started.
So it's the middle of the pandemic. I mean, what is the motivation to begin this type of thing at that time?
Yeah, I think when we think about doing this program elsewhere, it's really important to talk about how much work went into before this started. There was a long-standing partnership between my boss at Prevention and Health Promotion and the school district and all of our school districts. They have a long history of doing suicide prevention work and substance use prevention work. And there's just a strong, trusted partnership and relationship. And so this started through that work. And one of the things that used to come up quite a bit is we have in the public health department and across the state, any public health department has what's essentially a county-wide strategist. So there's somebody who is a subject matter expert on what works to prevent tobacco use, vaping, suicide, and they work across the whole county and aim to get effective programs, policies, practices. But that's really difficult. We can give guidance, but we still need, especially in schools, the on-the-ground implementation support to work on how do we train people, how do we support them through it, how do we bring in resources. And that's essentially where Healthy Schools was created, of saying we have great guidance, but we need some implementation
You've got the
support.
brochure.
Mm-hmm. Yeah, you got the brochure, but the brochure doesn't quite change our behavior.
Yeah, right.
So we need that kind of coach along
We need
the
to be
way.
humans somewhere in there.
Yeah. And so we just are there alongside the schools when they're making the plans, when they're rolling it out. You need someone to write the letter that goes home to parents. You need someone to organize the training for the teachers and figure out what trainer to bring in, help figuring out which curriculum to do. That's really what we do, is really ongoing support.
Yeah, and when we were talking a little before this, you were saying it's not to be confused with the school counselor. Mm-hmm. And maybe just talk a little bit about what are the services that that you provide within these schools. What can people expect from this attention?
So I was originally a teacher, and teachers are trained to have your classroom of students, assess your needs of your classroom, and usually that's knowledge gaps or skills gaps, and like what are we missing for reading or doing math, and then putting in your curriculum and then evaluating. That's really what education does very well. Education does not do very well public health change and big systems change, and really addressing things like youth mental health crisis, vaping, epidemic. And so what we do is really look at the population data. We're experts in what is the community health need. What does the data say? How do we get a big change that has multiple strategies happening at once? Because adolescent health issues are pretty complex. No one thing is causing it, and one thing
that seems like the understatement.
Yeah. And so a counselor is going to do what a counselor normally does, and they might be doing small groups or coaching an individual student, working on academic plans. A nurse is doing what a nurse does, and they are working to triage, student illnesses that are coming in, and help connect them to care. We're not on an individual level. We're looking at the entire school population, and looking to see what are the inequities, what are the systems gaps, what's the resource gaps, and then we're really able to navigate that system and bring in community partners.
Okay, great. I mean, I got to think that since the pandemic, we know from talking to teachers, and I mean, maybe I just know because I talk to more teachers than most, but there's a real crisis. I mean, it isn't the same as it was before the pandemic. And I will segue, and Megan knows this. I always feel like I'm getting obsessed with the pandemic, and I talk about it too much. But for me, it does seem like such a change, and it has such a heavy impact on schools, probably more so, I think, than any other aspect of our community. And here you guys are starting out with this 50-50 good faith partnership in 2021. That dynamic has got to have changed. Like the needs for what you're experiencing now, because I hear the kids are gapped now. There's there's so much more challenges. It's not just that the classes are contained and you got a really good demographic here. It seems all over the place. Is that accurate? Is that what you feel like you're experiencing?
Yeah, schools are definitely experiencing a lot of challenges, and public health is too. We both systems were pushed into a lot of change
Right.
just to respond to COVID-19 and keep everyone safe, and then adjust our services based on how we needed to with distance learning or
Right.
with providing services through telehealth. And so both systems are experiencing change. And now we're in the aftermath of that change where the amount of technology use that we're using in school the right amount?
Right,
We
right,
adopted
right.
it because we had to. Now we're just kind of in there, and it's a lot of work for especially teachers when we have an hour of prep for a full day of teaching, and you have to take all of your lessons that were online back offline and adapt them.
Yeah, yeah,
It
yeah.
is a lot. It's a slow process.
Yeah.
And just the needs of students have changed. And so now teachers are needing to address mental health in their classroom
Right.
before they can even get to the content, and they're not trained
Right.
to address student mental health.
Yeah,
and
that's
why
what I
we're
hear
there.
is that the challenges are kind of overwhelming because they're asked to, you're a math teacher, but also those two students there are mentally challenged, and, address that as well. And then, oh, hey, shift over here. So
Yeah.
am I right in saying those are the kind of things that you provide support for?
We,
I mean, I know not individual counseling, but
yeah.
how do you interact with that environment?
We help with identifying effective curriculum that can be used, and then bringing in campaigns that can be
Okay.
helpful so that students have more coping strategies. So one of those, just an example, we have the Sources of Strength program, and that trains student leaders to do positive mental health campaigns across their school and be a connector to help. And they end up making this positive change in their community. They change the culture in the school. We have health curriculum that helps students learn more coping strategies. So we may not necessarily be coaching teachers in teacher training because they have their own training for that. But we're working on what are the effective prevention programs and practices we can put in that will help reduce anxiety, depression as a barrier to learning.
So you're going directly to the students with this information. It's not really that you're training these teachers, but you're giving the students empowerment techniques or just ways to flag inappropriate behavior, things like that.
Our program uses what's called a coordinated school health approach. And
Yeah.
so to be effective, we should have students spreading that message to their peers,
Yeah.
teachers also reinforcing that, and then also families reinforcing that. So we're actually working on all of those levels where you have family engagement, giving families tips and tools to talk to their student about mental health and ways that they can get help or things that help them cope with their stressors. We also do that with teachers. Primarily, we're doing that a lot with our health teachers, but then we work with building leaders so that they can also do that with all of their teaching
Wow.
staff. And then we have the students, that we train.
That is such a tall order. Like
It's very complex and
you're
big.
talking about going in and affecting a cultural change through these students who, man, their minds are going a million miles an hour.
You'd be very surprised, though, at the talent and skill and just effectiveness that students have. Our goal is to have students as our equal partner in
Yeah.
the work. And if we take a step back and listen and just support them in what they want to do, they can really do some great work because they know what the lived experience of a
Sure.
teen is right now
Right.
and what they're experiencing. And we didn't have the same things that we were working
Oh,
through.
I have no idea.
Yeah.
I realize I have no idea what those guys are going through right now. It's
lot.
so different, I think, and coming up through all the changes that they've had to experience and how fast life moves now. I mean, I'm nostalgic for how slow it was when I was a teen, and I thought my teens were terrible. But now I look at it and I was like, yeah, maybe it wasn't so bad. It could have been worse. I could have had a pandemic. Who knows?
Yeah.
Yeah. Well, that's amazing. And in implementing those things, I'm curious because, there's this discussion that keeps raging about, what a school should be, that a school is, reading, writing, arithmetic, and that, a lot of the services that you guys are providing, a lot of this stuff that's cultural that helps us think doesn't have its place in school, and what is the role of school in it. To me, it feels very ill-defined right now. Like there's the idea that, reading, writing, arithmetic, but nobody actually wants that. When you come to the brass tacks of what implementation looks like, do you find that you have to sell these concepts of cultural change as head of these departments?
There's times, and it depends on the specific practice that we are recommending. There is times where we have some friction between what is recommended as a best practice, like reducing out of school suspension for substance use. It's not recommended to do an automatic out of school suspension if a student is using substance.
See, there's a
They need
great
more
change
support.
from when I was in high school. You were out the door.
Yeah.
I
mean, wouldn't you love to go home and
Yeah.
be not monitored and, be
I can
able to
speak-
do what you want to do?
I
You're
can
tired.
speak from experience on that. Yes. You definitely want to go home.
So, our recommended practice now is to, perhaps do an in-school suspension and then do a screening, a referral to treatment, and a brief intervention to address the underlying health issue, because that is a health concern or a health condition. And so we want to be restorative and educational about it.
And you get pushback on that.
There's times.
Yeah.
For the most part, across the district, we have a program from Deschutes County Prevention and Health Promotion called Upshift. And it's actually in all districts in Deschutes County. So Sisters, Redmond, and Ben Lapine schools all have this protocol as an alternative to out-of-school suspension. But that's 3 years in the making, and it's been working through, and just some individuals who have just the tough approach.
Yeah, tough love.
Like we've always done out-of-school suspension. We have a no-tolerance approach. So there is still, it was working through that, but for the most part, we have a lot of consensus on it. But there's times where we do have to explain why this is a best practice. And generally, we get just a lot of acceptance and adoption. I think we are well trusted because we do our background work and make sure that what we're recommending is effective. And we look to see, is this going to be a good fit for where we are right now? There's things that we might want to do or that some people want to do that are just a little bit out of reach and we're not ready for.
Yeah.
And that's the
When you
benefit.
say out of reach, you mean culturally out of reach. Just
Could be culturally or just the complexity of a system.
Yeah, okay.
Or just when we have high levels of burnout and this is a new thing and we're working through, adopting a new standard and adopting a new curriculum. It's just not a good
and people
time.
are like, enough is enough.
Yeah, and that's the benefit of having the on-site public health staff.
Right.
At the state, we might have, a new law that's passed. You have to teach opioid prevention lessons this year, and you have to make a comprehensive substance use prevention plan. For us in public health, we're like, yes, we do need that. But in schools, they've got all these other requirements and priorities.
Sure.
And so we're there, I call it the double dutch. We're there just kind of on the sideline. We know what's needed. We're ready for it. And when there's a moment of peace and readiness and there's that pull, like someone saying, I need this help. And we're like, we got you.
Yeah.
We know what you need.
Right.
And we're there to help them.
How long do you, or is it an unending support in this 50-50 role? Like, can county pull out at any time? Can the school district pull out? I mean, what's the commitment to this collaboration?
We have very strong commitment on the school district side. We are looking for sustainable funding for our county side. We originally got our funding as a way to build the program, get started, and now we're starting to weave in additional funding sources, just knowing that general fund in the county is needed in a lot of places.
Sure.
And sometimes it can be unpredictable because it's based on, I believe, property taxes, but don't quote me. I should pay attention to
I'm
that.
sure it's property taxes.
So we look for some other types
Right.
of funding sources that could be long-term. We braid in our public health funding. But I think that's a really important question because when we ask our admin, can we have a seat at the table with you? Can you host a public health specialist in your building? Will you allow us to convene a school health team and start working on these long-term improvement plans? And usually their question is this just going to be a this year and a next year thing while you
Right.
have funding? Or is this something we're going to rely on? Because it takes at least 2 years to get a new program implemented. And then we need to enjoy that once we've done all that work to just get it started.
Right. I mean, the other thing I would imagine is a challenge is that you implement these programs for these kids and it takes 2 years and then they're out of the program. And then here comes a new set of children with their own set of challenges and you're working to get that plan implemented before they get out of the system.
That's the benefit of a public health approach is that when we're looking at a population health issue, generally those don't change that much. They're kind of slow changing. And so if we're looking at, well, what's the current problems? Okay, vaping, mental health. How do we address that in a way that's going to work for the population?
Right.
Those students who have it now will graduate and they'll become healthier college students
Sure.
or healthier emerging adults and families. And so the work should still continue on. It's just minor changes to address, what are we adding to it? What are we adjusting? But the underlying thing we're addressing and usually the strategies we're using are generally the same.
You've mentioned vaping a couple of times. How, what should people know? I mean, I have a child who vapes, so I'm intimately familiar with the addiction. What should people know about that? And is there hope that they'll end these cotton candy like inhales every 5 minutes sometime down the road?
Well, one, if we think about flavoring, there's often initiatives to aim to do some policy work to prevent flavoring from being available to students.
Yeah.
And we often need the community to help be vocal in that need. So that's a hope there that often we have some legislative action happening. But on the school side, for me, one of my hopes is when we first started this, I think part of the pool to bring us in was vaping's an issue. We're really concerned about it. We want some things right now. And so we were able to do a lot with getting some prevention practices in place. We have vaping prevention education that works. One of the programs that we're using has been proven to reduce experimentation by half, which is pretty significant. And as students are aging, we're starting to see less use. We see them use it for a shorter period of time and then start to reduce that.
Do you see a decrease in use currently amongst that population, or are you seeing it after they?
We're definitely seeing a change, but from when we first came back from the pandemic, there was a lot of use, and it was very visible because it was on campus, and we had to do a lot of response to change policies and address it because this was an emerging thing that hadn't been there before. And so we're trying to figure out as the public health people, what is the best practice, what's recommended. And then on a disciplinary issue, schools need to address that as a violation of the policy.
Right.
So a lot, had to happen with that.
Well, it's crept in under this guise that it was somehow going to help you not smoke,
but
it
not
was,
if you're a new person.
And I mean, all it did, just hooked a bunch of kids, and eventually they all go and try smoking because they've been vaping. It's just a hot mess.
One of our assessments that we did, they were asked why or how they started vaping. It was students who had been caught vaping at campus. And it was often, one, I'm very stressed and it helps me with my anxiety. There's other coping methods. But two, I'm very curious about the flavors. I smell the flavors. I'm very curious about the flavors. So it's usually mental health as like an underlying thing. If we address mental health, then we're less vulnerable to something that's going to be used to cope with the mental health challenges. And then two, if we work on making the things that are really attractive to students, like the flavors, it's just going to naturally attract their curiosity and attention and sensation seeking.
Yeah, it's incredible. Do you see a decrease in use? I mean, do you hope for a decrease in use? Where is that teenage community on the spectrum for vaping?
I need to go back and double check data before I say that we've had.
Yeah, I didn't tell you I would ask you that question.
Like suddenly I'm starting to think I'm like, ooh. But anecdotally, we do hear students saying that there's less vaping in bathrooms. And so if that's an indicator, it may be that they're vaping elsewhere, but we're hearing less about the vaping in the bathrooms, vaping out of the sleeve kind of things. So it's less visible, at least on those, inside the school. And other times we'll hear students saying, yeah, that's an old thing. Like 10th graders are like, no, we're not doing that anymore.
Yeah, good.
So I do think there was a period of time, and I think we're learning a lot more. But I do need to double check data to
Yeah.
make sure.
No. How, changing subjects, to mental health, anecdotally, again, it seems like there's a rise in mental health needs within the school, that you're having more challenges on that front. What's your role in addressing that that's different from school counselors and
Yeah.
such?
I think if you think about it a school counselor has their lane
Right.
and their practices. A health teacher has their lane, which is really a classroom, and their curriculum and practices. Admin are addressing some of the symptoms that they might see when they come out as behaviors, like disruptive behaviors. And what we're doing is, as the public health team, we bring all of those people together to say, this is the overarching priority that you've identified, and how do we want to address it? And so as a team, the most common priority that came out was that schools want to improve student belonging, student engagement, student connection, student safety. And that relates to mental health because that makes
Sure.
them have a better experience in schools. And so then we identify, well, how are we going to do that as a system? And so it's just aligning what everyone's already doing, maybe making some minor changes to use some effective programs. So for instance, if we are aiming to prevent suicides, we look at, well, what's the curriculum that we're using? Are we all using an effective curriculum? Do we need a training on it? And that's what
Yeah.
our team's doing.
When you look at, you've been in this program's been going for 3 years now in this format. What do you think about for the future? I mean, what is the stuff that you've already implemented, but what is your hope and dream for what you'd like to implement?
Oh, man. My end goal, you asked me, I'm a visionary, so
Yeah.
prepare yourself. So there are states that have legislated coordinated school health, which is essentially what we do. And they appropriate funding for that. So Tennessee and Texas both have like a state office of this type of public health approach to
Not
a
the
healthy
two,
school.
not the two states I thought you were going to mention.
know.
Yeah. Leading the way.
Yeah, well, they've done it in, this originally started with obesity prevention. And so Tennessee, its focus was physical activity, nutrition, reducing obesity. And they had positive results for that work that they did. Ours, we're doing it in mental health and behavioral health.
Okay.
But yeah, eventually I'd love to see us using this model across Oregon, particularly with the use of public health, so local public health in schools. But we do need a lot of work to get there because I happen to be a teacher who has quite a few years of experience doing school-based prevention work. But our local public health system does not have that training, doesn't really know what are the structures, what are the levers in a school system. So I just happen to know the education system and was able to bleed that together. But yeah.
Do you find that with regard to mental health, especially in our county, we know resources around that are so strained, and you're against that. You're part of that. I mean, there's referrals from the school to that, and I know that's not you guys, but how do you make the case when every one of these organizations in mental health is making the case that we're the organization that needs this funding?
Yeah, it is tough. And if you're familiar with how our coordinated care organizations have community benefit funds, you do see a lot of competition across the region for those funds, and they would be suitable funds for us, but we know that there's a lot of need across the entire Central Oregon region. We are looking for sustainable funds for this work, and it's tough. We actually are in this middle place where there was a great grant from the CDC that would have been 5-year funding, exactly what we're doing, because I built the model based on those best practices.
Right.
But you had to have at least 40,000 students. And so that would, even if we put all of the Central Oregon region together, we didn't have 40,000. There's only one district in Oregon that has 40,000 kids. So then we're automatically out of that. So we're in this kind of middle ground of, not rural enough for some funding and then too rural for other funding. So that's just the inherent challenge. I think what we find, though, that's beneficial for us is we are a connection between the community-based services and inside schools, because
Right.
many, we have a wealth of resources in our community ready and wanting to serve schools. They don't always know how,
Right.
and they have a hard time getting in. And so who do you go to? There's not a one person that can help you navigate it. And so we are, in a sense, kind of a navigator for community organizations that want to get in and do services in schools, not necessarily therapy, because that would go through the district's
Right.
student services, but other types of resources. Like there's a lot of community services that families don't know about, staff don't know about. It's very confusing for them.
Sure.
And our job is to know all those resources and pull them into one kind of comprehensive,
Yeah.
Information bank, if you will. That's not the best way to say it, but basically it looks like a flyer that just says, here's a wealth of resources. Let's help you figure out which
Yeah.
one you go to.
Okay. We are at the end of our time on the podcast. Is there anything, I know there's a million things, but one particular thing that you'd like to speak to before we
Yes.
part?
We are working on our program evaluation. Our end goal is to prevent youth suicide, substance use, violence, teen pregnancy, sexually transmitted infections. And we are working on our evaluation. We are going to be reporting some data soon that shows a correlation between healthy schools and a reduction in emergency department visits for
Wow.
students of our age related to substance use and suicide. And it's very significant data when you look at it. So be on the lookout. We have a website. If you go to if you search in Google for, or whatever browser you use, for Deschutes County Healthy Schools, we'll have our report on there. And then we'll have a Board of County Commissioners meeting coming up shortly. And we have a webinar coming up soon.
That's great.
So lots to see.
Well, I'm sure we'll have a source reporter eagerly waiting the email to cover it. And sounds like we'll be back in touch.
Great.
Aimee, thanks for spending the time today and explaining all that. It's really a layer of the service network that I never really understood. And I think that analogy you had of being the gateway for people to understand how to disseminate that information is kind of crucial, because you can barely figure out how to rent a gym, let alone get the services you need from the network.
Working on that too.
Yeah, right. Yeah. Well, Aimee Snyder, thank you very much for being with us. This has been the Bend Don't Break podcast. If you like what you heard, become a member and support us so we can continue to do more cool things like talk to Aimee. All right. Thank you.
Thank you much.
You've been listening to the Bend Don't Break podcast, powered by The Source Weekly. To read, hear, and see more of what we do, go to bensource.com.